today we are delighted to have Dr. Bridge Kennedy, Associate Professor of Psychology at UAB and International Sacred Harp Singing Facilitator, and Dr. Edie Hapner, Speech Language Pathologist, Professor and Co-Director of UAB Voice Center and Director of UAB Otolaryngology Speech and Hearing Services. And we're going to hear about the benefits of singing through both psychological and physical perspectives and learn some of the research and science behind singing. So at this point, I will turn it over to Dr. Bridge Kennedy.
Hello, I hope everyone can hear me okay. Give me just a moment so that I can go ahead and start sharing my screen. Okay, I hope everyone can see this. All right, I'm going to assume yes since no one has said no. I'll just slide things out of the way. All right, first of all, I like to give a little disclaimer. I'm not a researcher. I have somehow managed to turn the thing that I love into something that I also get to talk about at work. So I'll talk a little bit about singing for the health of it. And I really want to talk about the power of group singing and talk about group singing from the perspective of being a shape note singer. We're going to go over the outline here. So we're going to go over some general health benefits of singing first. And then I want us to address the question of whether or not singing is singing. Like, is all singing equal? And I guess you probably already know the answer to that question. So we're going to look at the differences between high stakes singing versus low stakes singing, and then also talk about group singing and talk a little bit about shape note singing because I am a traditional shape note singer. So I'll talk about what it is, talk about what it isn't, and then talk about potential research areas and maybe even therapeutic use. So hopefully I'll get to work with Dr. Hapner at some point. All right, other than today, that is. So let's talk a little bit about some benefits of singing. There's something very special about music in that it has a very unifying effect. It unifies by crossing across racial, ethnic, religious, and cultural, and so many other barriers. And additionally, researchers have found that music in general and singing in particular has some very positive physical and psychological benefits, including things like improved blood pressure, heart rate, pain reduction, cortical thickness increased, which of course can serve as protective factor for several things, including several forms of dementia. We have reduction in anxiety and reduction in depression symptomology, as well as reduced agitation for individuals with autism, Alzheimer's disease, and other dementias, including Parkinson's. And there's also improved cognition and an overall reduction in stress. So I like to think about how at the very root of music, there is rhythm. And each of us have been imprinted with rhythm since the foundations of our existence. So for approximately 9 months, as cells became tissue, as tissue became organs, and organs formed systems, we all heard the same song. Our mother's heartbeat together with yours formed the most beautiful rhythmic syncopation ever composed. And we share this in common with every human being who came before us, our ancestors. We share this with every human being currently in existence and with all those to come. Well, since singing clearly has many health benefits, is it safe to assume that all types of singing will prove beneficial in the exact same way? So ask yourself this, is all talking the same? Would you expect to have the same physiological response, for instance, to spending the afternoon chatting and laughing with a group of friends that you'd have if you had to deliver a public speech? Not likely, right? So, as you can imagine, then, bodies respond differently during low stakes singing, for instance, singing in the shower or with family during the holidays around the piano, versus high stakes singing, like singing for the sake of a performance. In fact, research shows that singing in high stakes professional contexts raises blood cortisol levels, while low stakes amateur singing has the opposite effect. And when our body is pumping out stress hormones like cortisol, this means that our sympathetic nervous system has been activated, right? In other words, we are in fight or flight mode. And you may ask, like, how on earth could there be any advantages to being in fight or flight mode when we are about to perform? The fact is that if you're too relaxed, you simply aren't going to perform at your best. Um, a moderate level of arousal plus being well rehearsed is going to yield a more optimal performance. Under these conditions, that increased heart rate, that increased respiration, increased glucose production will supply valuable oxygen, oxygenated blood, and glucose to our lungs, our muscles, and our brain. So, if you decide to run off the stage, you're going to have the energy to do so. But if you stick around, you're going to have the energy and increased cognition to go ahead and go through with the performance as well. Now, thinking about decreased digestion and decreased bladder retention, how do those things fall under the advantages category? Well, we really need all the energy that we can to be shunted to the things that are responsible for fight or flight or getting us to a moderate level of arousal. So you've heard people talk about butterflies in their stomach when they get nervous, right? That's that decreased digestion when we're in fight or flight mode. And also, we don't realize how much energy it actually takes for us to hold our bladders until we get in a tight. And that's when we think about, whoa, this is taking a lot of energy. So if you ever wonder why sometimes people wet themselves when they're nervous or upset or frightened, that's because, you don't have time to um, tense up your bladder for that bladder control, right? Now, of course, hopefully that performance is going to be over soon and we can go back to relaxing. However, long-term or chronic stress may result in things like chronic fatigue, cardiovascular disease, metabolic disorders such as diabetes and obesity. Remember, you have all of that glucose free floating through the bloodstream there. Could result in depression, suppressed immune system, and immune disorders. Now, I know it all sounds horrible, but don't despair. I've got a solution for you. Good old low stakes singing comes to save the day. Not only are your cortisol levels lowered, but research shows that low stakes singing is associated with elevated mood and subjective well-being, as well as those other advantages of singing in general that we just discussed. As disadvantages go, long-term singing, even low stakes singing, could result in things like voice fatigue or worse, nodules. However, this is Dr. Hapner's area of expertise, so I'm going to tread lightly and just move on. Suffice it to say, aside from potentially irritating your housemate, your dogs, your neighbors, low stakes singing should serve you well. But music is more fun when we share it, don't you think? Have you ever been riding or walking along or even sitting in the comfort of your own home when suddenly your teeth and your windows start to rattle as you're assaulted by some unbearably loud music coming from a passing vehicle? When I was young and a bit more judgy, I used to refer to this as the mating call of the ignorant. But as I've aged, I extend those noisy offenders a bit more grace. Why? because at the core of our existence is the need for affiliation, the need for relationships. And this makes us want to share the things that turn us on. We want to know if anyone else is being turned on by the same thing. The need to belong is a basic human motive. It's a pervasive drive to form and maintain lasting relationships. And there's a burgeoning body of research that suggests that group singing is associated with quicker relationship development. So, I'm sure now you're curious to know the mechanism that may be responsible for why relationships might form more quickly during group singing. Now, one 2016 study of 193 participants found that only after one practice session and one choir session, participants showed reduced cortisol levels. Remember, that's that stress hormone, as well as elevated endorphin levels. Endorphins are our body's natural morphine, and it's associated with relief of both physical and emotional pain, pleasure and reward, as well as improved mood, just to name a few. Now, similarly, and this is very important, elevated levels of oxytocin were noted. Of course, oxytocin is implicated in, amongst other things, pair bonding and relationship formation in general. Now, several studies have yielded comparable results. However, it's important to take into consideration that teasing apart the why of it all might be complicated. The 2015 NICE, or National Institute for Health and Care Excellence study, states that it's unclear whether it's the singing itself, the group-based nature of the activity, or something else that produces the benefits. In their 2020 article, researchers Kirklin, Daffern, and Zetterson suggest that the reason this something else has eluded us is because the benefits of groups that I'm singing consist of a set of interdependencies that might be thought of as adaptive complexes. And I just love this description because for several years I've described the type of singing that I do and my relationship with this music as symbiotic in nature. In order to keep this somewhat obscure tradition alive, there are singers who must sing the music, and at the same time, we feel a very strong need to sing the music in order to stay alive ourselves. And we notice how important that was during lockdown, when singing was considered a or singing in groups was considered a very dangerous activity. We had people trying to sing on Zoom and finding other computer programs like Jamulus to see if they could sing together. So by now, it probably sounds like I'm about to sell you some snake oil, and I promise that's not the case. So far, I've been describing what researchers have already found in regards to the benefit of singing under various conditions. But admittedly, and you can probably tell, group singing holds a particular interest for me because it occupies a great deal of my time, and I just love it. While I've engaged in choral singing since I can remember, for more than 2 decades, I participated in singing shape note music, which is sometimes called facilitator or sacred harp music. And I'll give you a very brief description of what sacred harp music is, as well as what it isn't. And then I'm going to posit why I believe this form of music holds potential therapeutic value. Now, while shape note or sacred harp singing is a uniquely American tradition, it has gained popularity around the world. This music brings communities together to sing tunes in 4 to 6 part harmony. Now, it's very inclusive. And the purpose of the music was and still is to teach beginners to sing. All events welcome beginners and newcomers, and no musical expertise nor religious affiliation is required. That being said, I have to say, much of the poetry or tune lyrics could be described as hymns or psalms or anthems, and this is simply due to the fact that this style of music found its roots shortly after the Great Awakening, with the first sacred harp tune book being published in 1844. However, I personally know Jews, Muslims, Hindus, Buddhists, atheists, people from all religious backgrounds. I sing with them all the time. Now, singers are not reenactors. Sacred harp singings are not performances. There are no rehearsals. There are no separate seats for an audience. Every singing is unique and self sufficient, and there's always a different group of assembled participants. So no one marks you absent if you happen not to show up. We may worry about you, but no, you're not going to get in trouble. Now, I'm sure that you've noticed that looking at this slide, the notes have shaped note heads, right? The note heads have very unique shapes, and hence the term shape note music, right? The shapes simply aid in the sight reading process. And I bet there isn't a person in this Zoom room who hasn't heard of do, re, mi, fa, sol, la, ti, do. But what many people don't know is that each of those syllables, do, re, mi, fa, sol, and so on, have a corresponding shape. It's just another form of solfege. Think about it. Back in the 1800s, many people couldn't read at all. So, how on earth were you going to teach music to illiterate people and to do so quickly enough to improve the singing in congregations? Well, shape note singing or shape note music worked then and it works today as a teaching mechanism. I'm going to show you a video of, hopefully, we'll see. Well, I'll click on that and, well, that's a shame.
Well,
We we had that working before.
Dana, could you
yes.
play that? Okay.
Yeah.
Dana's gonna play it for us.
Okay, fantastic.
I'm going to steal your share, so hang on.
All right, that's fine.
Susan. Of course, it picked the wrong one.
Mm.
Stand by, guys. There you
All
go.
right. This fellow was a lot younger and a bit more. Fantastic. Dana, if you can just take us on to the last slide. All right, thank you. I should mention that sacred harp and other shape note style singings differ from choral group singings in some ways that I'm sure you observed, um, and in some very crucial ways as well. I'm just going to name a few and then mention why these differences are important as they relate to potential research and possible therapeutic practices. The singings are intergenerational. At most singings down south, they're going to be 5 generations in attendance, and sometimes from the same family. and all family members are engaged in the exact same activity. You won't be able to say this about even if you go to Timmy's T-ball game, right? Everyone, you may have 5 generations there, but they're not all doing the same things. And secondly, because shape note singing is not performed in a professional context, it's low stakes, it's amateur, it's come as you are, it's no rehearsal style singing. And recall that low stakes amateur singing tends to decrease cortisol levels. So I think that there's so many therapeutic advantages there. And this is something very near and dear to my heart. Voice-related gender dysphoria is a thing. Um, and many transmasculine singers freak out and actually disrupt their chemical transitioning or hormone therapy anytime their voices start to drop because they're afraid that they're going to lose their ability to sing. Um, Now, furthermore, male to female trans singers could experience a more complicated issue. Estrogen therapy, unlike testosterone therapy, provides no voice change. Therefore, many trans women who sing or who sang previous to transitioning, they may actually quit singing for fear of suffering embarrassment for their naturally low voices. And when music is so important and so therapeutic, here we have one of the most marginalized groups and people who suffer from such great um, psychological disadvantages in many cases due to cultural adversity, mostly. They could be benefiting from singing and they stop singing. Now, shape note singings are divided into parts based on voice, but gender isn't a concern as long as individuals can hit the notes. Furthermore, it's not common for people to change sections throughout the day in order to accommodate for their voices. As their voices warm up or cool down, you just move to the part that feels right, which is good for the voice altogether. So in this way, shape note singing is a lot more healthy than choral singing because you get to sing where your voice feels comfortable and you can move throughout the day. Now, fourth, shape note singings are usually set up in a square where the altos face the tenor and the bass face the trebles. And research shows that eye contact increases oxytocin levels, which, as I've already stated, is implicated in bonding and relationship formation. So, if we know that singing together in regular choral settings increase oxytocin, then what do you think occurs when we are singing together and making eye contact? I'm just going to go ahead and hypothesize that we're going to observe like stronger and faster relationship formations due to the production of even greater levels of oxytocin. And then there are things going on with mirror neuronal activation, which is going to increase bonding and increase empathy and compassion, which are going to foster love. And we know that love conquers fear. And then I like to think that then we're going to have world peace. Now, the world peace portion is more hope than hypothesis, but before you scoff too boldly, keep in mind that on September 27th of this year, the Global Music Diplomacy Initiative was launched by the government, and this is a worldwide effort to elevate music as a diplomatic tool to promote peace and democracy. So I may not be that far off. I hope I haven't gone on too long. I'm going to end here and we'll get ready for Dr. Hapner. Thank you for your time.
Thank you so much, Dr. Kennedy. That was so fascinating. And now we'll turn it over to Dr. Edie Hapner.
All right. Let me take a second of your time to get my. Can I hear? On like some big Zoom. Are we doing okay? We're okay? Yes?
Yes.
All right.
Thank you.
Perfect. Thank you. Well, thank you, Dr. Kennedy. You're a hard act to follow, but especially when we end your talk with world peace. So I'm going to do my best here. And I also want to thank the UAB Arts and Medicine group for inviting me to participate today. It's really exciting. So I want to start by saying that the joy of music is all around us, and singing is all around us if you just take a moment to listen. From birdsong, can you hear that okay?
Yes.
I think one of the most relaxing sounds too. Just listen. Whale song, that was actually a whale mother talking and singing with her calf. To the sound of beautiful music, the beautiful voices that surround us.
That's all I ask of you.
Well, we're going to stop all these again. And I will say that those are two of my colleagues that I get the pleasure of listening to sing when we have parties together. And this was from Saturday evening. Okay, so if you will humor me for just a moment, I want to bring us around to the kind of singing that I've been asked to talk about today. And that is singing in populations of people that aren't healthy, but that find joy and actually therapeutic help from singing. So this, I hope you'll enjoy. This is the Parkinson's Choir, and all of the people singing here have Parkinson's disease.
Lost away, where we can fly again and start to sing.
There's a place we go where we can make a choice to strengthen heart and mind and voice. The winds blow hard, the flight may slow, the journey's new, don't know where to go. Words are sinking down, so we need to try to sing like a nightingale, to laugh like a child, to find your voice.
And all of these people sing together on a monthly basis and have found not only the joy of communal singing, but also the therapeutic impact of it. So let's talk a little bit more about that. You know, there's been a lot of research into the benefits of singing for people with different type of neuromuscular disorders and others. So here's a study that talks about the benefit of singing to the voices of people with Parkinson's disease, the benefits of singing to people with chronic obstructive pulmonary disease, COPD. And this is an amazing study that was published in 2015 that actually says singing improves the cognition of people with dementia. I don't think we have anything else that improves the cognition of people with dementia. And as Dr. Kennedy talked about the health of singing for people without disease, did you know that all of us would benefit our respiratory system singing for respiratory health? And that singing actually moderates the effects of aging? Forget Botox, guys. All we have to do is sing. And what is most fascinating is this study out of my world that found that people who sing with regularity are perceived 10 years younger than their age-matched counterparts. Think about that. Start singing. So why is this so? I'm going to briefly take a dive into what makes these beautiful voices of ours. So all the sound that we make comes from, I hope you can see me, a very small piece of real estate on the front of your neck that is called the larynx. And let's listen just for a second to a quick tutorial on the larynx.
So the larynx is this set of structures here, and you've got cartilages, muscles and ligaments which make up the larynx. So below the larynx it's continuous with the trachea, and above the larynx you've got the pharynx.
The
So
throat.
you've got the pharynx above and the trachea below. So the function of the larynx.
So what you're doing is you're looking at a very large image of the larynx that is just the housing for our vocal folds, protects our vocal folds. And so let me take you to a little bit deeper dive in your innards to actually look at what happens inside those cartilages of the larynx. Right now, what you're looking at, and you're going to hear my colleague talk, I think, a little bit.
Excellent job. Hold out.
You're actually looking at a scope going over the palate.
Good. Say pop,
Going to
pop,
clear
pop.
up in just a
Pop,
second.
pop, pop, pop.
Go breathe through your nose. And now give me a
Over
good
the
swallow.
nose,
Good.
down
Do that
the
one more
throat.
time. Pop,
Here it
pop,
comes.
Pop, pop, pop.
Good. Breathe through your nose. No, just easy. Just easy. Stick your tongue
You
out
see
at
your
me.
tongue, the base of your tongue, and this
Good.
whole area
And then
right
you
here is
Whee!
inside your larynx. These little white things are your vocal
Good.
folds
Now let's do
that
that sniff.
help you sing, help you speak, help you cough, help you breathe, and help you be safe
5
when
times in a row.
safely swallow. So when you breathe, they open, and when you make sound, they close completely.
That's
Let's take a little bit closer look at them. So now we're all the way on top of the vocal folds. Here's the right vocal fold. Here's the left vocal fold. Now they're positioned in a vertical plane, but they're actually horizontal, separating your throat from your lungs. And your vocal folds vibrate faster than the human eye can see. So mine vibrate about 200 times a second. A male voice is about 100 times a second. And so a lower pitch, the lower the number of vibrations per second, the lower the pitch, and vice versa. So we add a strobe light, yes, a disco light, to our exams to give us the impression that we're seeing slow motion of the vocal folds, and you're going to see that right here. Those are the insides, and they are no bigger than your fingernail, even though they look very large here. So, what are those little teeny structures? Well, actually, they're muscles. The vocal folds are muscles protected by 4 layers of tissue, different consistencies of tissue to cushion the blow. So think about it. If my vocal folds vibrate 200 times a second, and I'm going to talk for 15 minutes, take 200 times 60 times 15, and we are talking about hundreds of thousands of this in a second. Imagine a teacher who's teaching all day and how many billions of times those vocal folds vibrate and how much they actually do for us our whole life. So, speaking of whole life, just very briefly, I think what's so fascinating, and especially for anyone on here who sings, is the development of the vocal folds throughout the lifespan. We all know that a baby's cry is different than when a child becomes an infant. So we are born with vocal folds that aren't very discrete. There's not 5 layers. There's actually just a blob of muscle. And as a child gets older, they differentiate into 2 layers. Remember I talked about 5 layers? So 2 layers, but you know a baby's voice changes, and that actually is a differentiation into the 2 layers. And then somewhere around 6 to 12 years old, they differentiate into 3 layers. So muscle and 2 layers of protective tissue. And it's not until 17 to 20 years old that our vocal folds mature into that 5-layer structure. And if you think about the little Annies of the world on stage and the demands that we're giving those 8-year-olds singing, when they're back at a 3-layer structure, they don't have 4 layers. They only have 2 layers of protection. You can understand why so many of those kids can get in trouble. And it also is something that voice teachers and speech pathologists are paying a lot more attention to these days. So, briefly, our voice is not just produced by those little teeny vocal folds, but rather by a coordinated system of your lungs, your larynx, your vocal folds, and everything that happens above them. The throat walls, the mouth, the teeth, the nose, all work together to make beautiful sound. So what happens? Well, your lungs, your brain says, we're going to make sound, and your lungs send air up the trachea to your larynx, to the vocal folds. Then the vocal folds vibrate that air to make sound, and then that sound is shaped into words and beauty above the vocal folds. And look at this wonderful MRI demonstrating how people change their tongue position and it changes the sound. This is the palate. You can see it moving and closing so air doesn't go out of the nose. So, as I said, the vocal folds are muscles. And just like muscles in the rest of the body, we all know that if we lay on the couch too much and we don't exercise, our muscles atrophy. As a matter of fact, the vocal folds are the same muscle as the arms and the legs, just protected with those other layers, skeletal muscle. So what happens to the arms and legs can happen to the vocal folds. And you know, we all understand that we need to stretch. You know, Pilates and yoga are so good for joints. Well, the same joints in your knees and your elbows are also in your larynx. So stretching. And how do we stretch our vocal folds? By getting higher and lower. And the truth is that the more we learn about the larynx and the vocal folds, the more we understand that voice rest doesn't really hold a place in taking care of your voice. There are very specific times that we use voice rest. Think about in orthopedics and what they've learned. You have orthopedic surgery, and those nasty orthopedic surgeons are having you up walking the same day because vibration is what causes healing in our body. The same thing in the larynx. So I'll talk about in, I think, the next slide or the slide after, when we use voice rest. But everybody thinks that resting their voice is the way to make it better. And I'm here to tell you, nope. In many cases, not so. So I wanted to show you, and I hope this picture is not too dark, of what vocal atrophy looks like. So these are normal, healthy vocal folds, and these are atrophic vocal folds. These cartilages right here that you can't see very well are very obvious in these pictures. They get thin, just like our arms and legs. So I want to end my little part of the talk with talking to you about ways to stay vocally healthy. I'm going to go through a list, and some of these you may not know. You know, we all know about staying hydrated, and everybody thinks, oh, drink water, drink water, drink water, and that's the way to keep your voice healthy. But I'm here to tell you that anything you drink or suck on will never get to your vocal folds, because your vocal folds, if any of that gets to your vocal folds, you're going to cough and choke. Their primary job is to protect the airway. So nothing should ever touch your vocal folds that you drink or you suck on. But something that can help your vocal folds is steam or vapor, something you breathe in. And I'm going to show you a steamer. I think it's next. Yes, so here's some little steamers that can keep your vocal folds healthy, and they can all be purchased online, and only water in them, and you breathe it in. And most of my singers are going to do it 2 or 3 times a day. If you're a teacher, if you're a clergy member, if you're an attorney, someone that uses their voice a lot, steaming can really keep your vocal folds healthy. Of course, you can do it the old-fashioned way, the hot water over the stove. Let me go back one slide. I also know that many of my patients come in and they've got their pockets full of cough drops. Cough drops are not meant to keep your voice healthy. Throw them away. Anything that you suck on and you go and you feel a cooling sensation has menthol in it, and menthol is very drying. Get rid of them, all right? Instead, here's some favorites. You can use plain old Jolly Ranchers, to be honest with you. They're tart, they make saliva, and that's the goal here. Or these all have a little bit of glycerin in them. Rescue Pastilles come from Sprouts. Lacquerol comes from World Market. And Grayther's Pastilles come from Amazon. And they have some glycerin in it. They will never touch your vocal folds, but they're soothing to the throat. All right. Check your medicine. If it's very drying, there are medications out there that can cause voice problems. And please, please avoid firsthand or secondhand smoke. Another important thing to remember is if you have a voice problem for longer than 3 weeks that is unexplained, your cold gets better and your voice stays hoarse, please see your ear, nose, and throat doctor. There is not another specialist that looks at your vocal cords and understands the health. When your internist asks you to open your mouth and say, ah, they can only see your throat. They cannot see your vocal folds. Reflux, an overdiagnosed cause of voice problems. Reflux rarely causes voice problems. If you have reflux and you take medication, if it is the cause of your voice problems, you should be better in a couple of weeks. Allergies rarely cause voice problems, and most people don't really have allergies that affect the voice unless they also have watery eyes and a runny nose. Remember I told you about voice rest? Voice rest we use after surgery only. Surgery on the vocal folds. And actually the latest and greatest research on voice rest is that 5 days is the maximum. I've had people come in and tell me they've been on voice rest for 3 months and then their vocal folds look atrophied. 5 days max. Most people only need a modified voice rest. If your voice is bothering you one day, cut down on things the next day. Cut down on singing in the car, talking over the radio, yelling upstairs, but you don't need to go on full voice rest. But do keep your body rested and exercised. Your voice is a mirror to your soul. So when your soul feels good, everybody knows it in your body. And sing as a way to keep your soul healthy. And then one more, indulging me. It doesn't matter if you have a larynx or not. This is a group of people called Shout Out to Cancer. Shout Out to Cancer. And they have all lost their larynx because of cancer. But listen.
Silent night, holy night, all is calm, all is bright, round the Virgin Mother to child, Holy infant, so tender and mild, sleep in heavenly peace. Sleep in heavenly peace.
I think that's a good place to stop.
Oh boy. Well, thank you so much, Dr. Hapner and Dr. Kennedy. I actually my undergrad was in musical theater, and there was so much that you shared that I did not even know about how to care for my voice. That was, a while ago. But
That's okay.
that was so so wonderful. And we've opened up the chat, of course, to anyone with questions, but I would be for Dr. Hapner, we hear a lot about celebrities, stars who get vocal nodes and have to get, surgery, some of them and whatnot. Could you explain just a little bit about how that can occur and what's done for kind of rehabilitating that?
So vocal nodules are something that occur in vocal overdoers. And so it's very rare that someone who is well trained vocally is going to have vocal nodules.
Mm.
But here's something that I think is going to surprise you. Vocal nodules are not operated on anymore. The treatment for vocal nodules is voice therapy, because vocal nodules are the only vocal lesions that actually heal and go away. So when people come into our office and they have vocal nodules, and I also would like to tell you, they occur a lot less often than you might imagine. Very rarely. We often see a lot of other stuff. But when people come in and we take a look at their vocal folds and we see bilateral, you always have two, bilateral lesions that are caused by how someone used their voice, we actually are happy because we know that they're going to heal if the person allows their body to heal and uses more efficient voicing.
Thank you. Thank you. Dr. Kennedy, I didn't know if you had anything to add or any experience around that in the sacred harp world.
Absolutely not. I get so much information from Dr. Hapner. It's like, whoa, what a wealth of information. I learned a great deal. I would like some advice. I know that you're just going to tell me stop being silly and do it.
I will
But
not.
oftentimes I'm placed in a position where I am like on tour and performing with people who are professional musicians and opera singers. And when I'm walking down the hall, I hear them warming up their voices and they're doing all those silly things, going from low to high. And I say silly because it really sounds weird.
Yeah.
Then, of course, I just show up on set and I just start blasting. And I know that that's not healthy. I know that it's best to warm up. What advice can you give to someone who just feels silly doing that? I
Well,
mean,
first of all, isn't that the fun part of voice? Voice is silly. So like, woo, all of that silly stuff is actually, and we know this from good science, helps you get rid of extra muscle tension in your throat and optimizes the way your vocal folds vibrate. So I would say, just like we know when we go to the gym or when we're going to go on a run, we have to stretch and get the blood going to the muscle and get it kind of ready for that vocal endurance task. We need to do that for vocal warm-ups too. A good 10 to 12 minute warm-up with some gentle vocal eases is at the most that anyone would need. And Dr. Kennedy, it'd be fun to get together and I'll teach you some warm-ups.
yes, please. Thank you.
Maybe that's next. Is we do go through some vocal warm-ups and how to take care of your voice and with vocal warm-ups and I have so one question we have is, where would we go to get help if if you're having a vocal problem, whether if you're in Birmingham, we know we have people from really up into Canada too. So, what would you suggest?
Do you want me to respond to that?
Sure.
Okay.
Open to both of you.
So, as I said, any voice problem that is longer in duration than 3 weeks should be seen by an ear, nose, and throat doctor. And you can look up, you can go to the American Academy of Otolaryngology. I am happy to share with you, Kimberly, if you would like to share with others at some point, but you can go and look there, and they have a listing of otolaryngologists in the area. I will tell you, to be honest with you, a laryngologist is an otolaryngologist. And you know, otolaryngology stands for oto. It's actually otorhinolaryngology, ear, nose, and throat. So ENT and otolaryngologist are exactly the same thing. But a laryngologist is an otolaryngologist who specializes in just the voice. And I used to have to say there weren't very many of them. And now, over the last 15 years, we've all been training them. And so there's a lot more to find. And that's probably your best bet, is to go and find someone on the AAO-HNS website. And actually, you know what? I can tell you, it's easy. It's ENTnet, ENTNET.org, ENTnet.org, and that's their website. Thank you, Lauren.
I have another question for either of you. Are there any, Lana's asking if there are any studies about the benefits of whistling or humming?
So humming is actually vocalizing. Your vocal folds vibrate when you hum. Your vocal folds do not vibrate when you whistle. So they just are moving in and out, but they don't really come together and vibrate. So humming is very gentle, as long as you don't but you HM. And you feel a little tickle here on your lips when you hum healthily. So gentle humming is actually is a wonderful warm-up. You know, even a just anything like that. I love humming.
Bridge, I don't know if you had anything to add.
No, I'm still just busy being blown away by all that Dr. Hapner is sharing. It's fascinating. It's one thing to I sing for the love of singing. It's another thing to hear from a firsthand expert on how to actually care for the voice, and I definitely need more of that.
You know, I don't think, and I already saw a couple of people this morning, who have stopped singing because they have voice problems. And there's nothing more heartbreaking to us than that. So we know how healthy it is to sing. And I always say to them, our goal is to get you back singing right away.
Absolutely.
Dr. Kennedy, I have one for you. Actually, both of you. Barb has asked, can you share some ideas and best practices to help a community choir to be inclusive of people struggling with health issues?
I would say to arm yourself with facts and research, and always go in gently and play to the side of empathy, expressing that music is for everyone. I think Dr. Hapner and I were in conversation earlier when we talked about when people typically have to audition for choirs, and I get it as someone who used to be in music ministry at church, and the music is such a big deal, but we have to ask ourselves whether or not it's more important to minister to the whole person, or to just make sure that, the sound is tight or on point, right? I mean, what are we really there for? And so I I think that, appealing to the empathy of music ministers, and letting them know that, people, that music is healing, and that everyone can benefit from it regardless of the quality of their voices.
I love that.
I know we're at time. We have more questions, but Dr. Kennedy and Dr. Hapner, do y'all need to sign off now, or
No,
Um,
stick
I
around
have
for the-
till 1:15, so I'm good.
Dr. Kennedy?
Yes, I can stick around as well.
Okay. Well, so I'll just say thank you to everyone for being here, and of course, if you need to sign off, do so. Thank you for being here. And our next Virtual Mental Health Monday will be December 6th at 6 p.m. with two of our favorite art therapists, Dr. Chris Strang and Dr. Patricia Isis. And so yeah, that's always a wonderful time. So just wanted to share that with everyone. But we'll go back to some questions while you both are still available. This one is for Dr. Hapner, and Christine asks, any insights to share about ligaments and the larynx? Some folks with connective tissue disorders like Ehlers-Danlos syndrome have vocal issues like voice control. I'm assuming this is related to EDS folks' wonky collagen that impacts ligament structure.
Oh my gosh, the issue with Ehlers-Danlos, there's two. One, there's been very little research done on Ehlers-Danlos and the voice, but what we do know is there seems to be a high incidence of voice fatigue as the primary complaint, and I believe that is from having to exert extra effort to get a stable sound. We've had some success. People always come in and say, oh, voice therapy, I've done voice therapy, but I just need people to understand voice therapy isn't a single entity, and that we target, just like in other therapies, we target the physiology and what needs to be done, and that kind of dictates the tools that we use. And so we've got some newer, better researched methods for increasing endurance. We've been doing that with, and honestly, people with Ehlers-Danlos, I 42 years in my career. Do you know how many people I've seen? 2. Yeah, I don't, so it's not, people don't walk through the door much, but I just saw somebody recently, and so I was looking through the literature. But we seem to be making some strides with some gentle endurance building exercises that are really targeting respiration and better resonance, and kind of not really trying to build anything in the larynx itself. I hope that helped. I'm not sure.
No, thank you. Another question is about a vibrato. As we age, is a vibrato when holding a note inevitable? How can one manage a vibrato if you are not necessarily wanting it to occur?
I know from a pathologic perspective, Dr. Kennedy, do you have anything to say about that? Because I can talk about the pathology.
Oh, I think you are the expert in this area as far as the physiology is concerned.
Vibrato is something that is volitionally put into the voice. All right. And vibrato is something that actually is used to reduce voice fatigue. Besides the beauty that we've gotten to enjoy in it, its actual real purpose is to reduce the fatigue of the muscle by not holding something constant. Vibrato doesn't just happen. Something that happens in the voice that is comes into is unstable is actually called vocal tremor. And so people are much more likely to develop organically, pathologically, a tremor, whether it's hands, head, or voice, as we get older. And there also are some essential tremor, like you heard in Katharine Hepburn. You know, you hear that. Used to hear that, but that's actually a something that's a lot more pervasive. But if it's not pathological tremor, then it's likely as a result of vocal aging, and there are treatments for that, and that is called voice building, and that is my area of research and interest. So it's not an accident, and you have to work to get rid of it.
I'm glad to hear you say that, Dr. Hapner. I, of course, have encountered people who have a great deal of vibrato in their voices, and it's not something that we encourage in group singing settings because it's a little bit disruptive in ways. It's like we're trying to. So
Right.
yeah. But I'm always hesitant to address those issues because first of all, you want people to enjoy themselves and have fun singing, but also you don't want to make the mistake of trying to get someone to address an issue that's not due to their own fault. So to know that there is a difference between a voice tremor that may be due to aging compared to like a vibrato, which is,
Yeah.
to know that it's vibrato. I'm sorry. That's that's intentional. It's
And there's treatments. There's therapy for aging tremor, and there's medications actually for pathological essential tremor. So there's treatment.
Well, thank you both. I have one last question, and it's for Dr. Kennedy, and I'm just wondering what your experience was. I believe you didn't grow up singing sacred harp music, and so what was your experience that first time that led you to now 20 some years later, facilitating shape note singing and sacred harp singing all over the world?
Oh, well, that's a question. Um, I was burned out in music ministry at church, and I had been engaged in music ministry for decades, and had gotten to the point where I was actually drumming of all things, and had been doing that for a number of years, and started off like really enjoying it. But I had a very intense music minister, and it was like it always had to be tight. It had to be tight. I was in college, so I was working. I was in college and in music ministry. So during the times where everyone else was being fed, like Bible study and but we were in rehearsal for band and for choir, and so it was just getting to be overwhelming. And oftentimes I would actually leave crying. It's like that. I don't think that's the experience you're supposed to have. Around the same time, my sister-in-law, Beth Ann Hill, was presenting her artwork at the Magic City Art Connection, and someone stopped by her booth and commissioned her to do a painting of a sacred harp singing. But of course, he said, if you're going to paint a sacred harp singing, you need to attend a sacred harp singing so that you know what it is you're painting. She knew a little bit about what I was going through in music ministry. And so she invited me to come along. So I and my family, we all got in a little minivan and went way down backwoods, Alabama. And it just got scarier and scarier as we got deeper and deeper into the woods because I grew up it's like if you want to get outside of Birmingham, then you get on an airplane and go. You don't just go flying off through Jasper and into whatever. But we were like way in the backwoods, and we were laughing and joking at first, and then things got a bit serious as it just got heavier and heavier, like lined with trees everywhere. And so we pulled up to this clearing because back then, you're following a sheet of paper, not GPS. So we get to this clearing and we get there early, and there's no one else there yet. And then someone else comes, and it's like, oh boy, you know, that person looks a little scary. I describe him as he gets out of his pickup truck and he looks like a fire ant in khakis. He was just huge, a giant fire. He's just huge. I was like, whoa, this is scary. And then he pulls a car seat out of the back. It's like surely he won't kill us in front of the baby. We're going to be fine. And then other people start to show up, and my family decides to get out of the car. And all of these people just converge on us and just start to welcome us and let us know how glad they are to have us there. And so we get in, and someone starts pointing out the shapes and the words and by rhythm. And they have me singing before long, and other people are doing that with my family. One of the things that's a part of the Sacred Harp tradition is to get newcomers to stand in the center of the square so that they can hear what the music sounds like from the center. And so the gentleman who invited my sister-in-law to do the painting got my family, and we're standing in the square, and I hear this tune that I'd heard all my life in the Methodist church. In our book, it's called Bridgewater, but it's called something else in churches. But the lyrics are, from all that dwell below the skies, let the Creator's praise arise. Let every the words just shoot out of my head. But anyway, we just sing it in a straight melody, or I grew up singing it in a straight melody, but it fugues in our tune book. And so when it started breaking off into parts, it was just this amazing surround sound of voices, and I started to weep uncontrollably. And I stood there, tears pouring down my face, and two gentlemen on the front row looked at each other and nodded their head because they knew, they were like, we've got one. And they certainly had, and I've been at it ever since. So that's a long story, Kimberly. Be careful what you ask.
Oh no, that was wonderful. And yes, that's the power of music and the arts. And so we need to wrap up, but yes, for everybody who is asking, this is being recorded. We will have it up on our YouTube, UAB Arts and Medicine YouTube, shortly. And yes, and I also want to recognize we have Dr. Emily Jaworski-Koryoff with us too. And so we are going to do a kind of a part 2 of this in the future. And Emily will hopefully join us for that. And we'll talk about the voice, singing, and trauma. So again, thank you all for joining us. Dr. Hapner, Dr. Kennedy, thank you so much. It was such a delight and a joy to share the space with you. And again, thank you everyone who joined us from all over.
Wow. Thank you all.